Hello guys, so today we're going to talk about basic metabolic panel, and this is probably one of the most common tests that is ordered at a clinic or at hospital. And today we're going to talk briefly about what basic metabolic panel consists of and how it's important. Let's jump to it. Okay, so these are the components of basic metabolic panel. Yeah, the first one is sodium. Na plus. The normal level of sodium is in the blood is 135 to 145 milliequivalent per liter. As you guys know, sodium is an electrolyte that is present in the body and is very vital for the body to function. And majority of the sodium is located outside the body, which is called extracellular, and we can find it in the one of the components of extracellular is in the blood. And as you guys know, if you guys have taken physiology in the past, which I'm sure you have, the electrolytes are really important for the function of the body, and such as, for example, the sodium potassium pump is very important for the cellular function of the body. And usually we get sodium in from salt, from table salt, like a sodium chloride. So when you order basic metabolic panel, you have sodium is going to be one of them. And of course, if it's less than 135, it's considered hyponatremia. And if it's more than 145, it's considered hypernatremia. And I'm talking about from a perspective of being in primary care. If you get the result and you see the uh, sodium like less than 135, for example, 133, it's not that big of a difference. So less than 135, for example, 133, 132. If the patient is fine, and mostly if it's like healthy young adults, I mean, I would just usually, or even older adults, if they're not symptomatic, I would usually just repeat it. And the same thing with hypernatremia. If it's 146, 147, yeah, usually we just repeat it. But if it's like goes to like below 130, I think it's important for us just to work up the to find out the cause of the either hypo or hypernatremia. If it's like more than 148, 149, I had an experience with this one doctor, and he told me that anything that belows like 132, 131, just send to the hospital, even regardless whether the patient is symptomatic or not. I think that we have to be careful in terms of patients who have hypo or hypernatremia, but at the same time, you just don't want to send patients to the hospital. If the patients are, I think, are symptomatic, you can work it up on the at the outpatient. So the second one will be chloride, and the normal value for this one is 97 to 108. I'm not going to talk I'm not going to talk a lot about chloride because usually when you see the chloride usually follows the sodium level. If the sodium is low, the chloride will be low most of the time. If sodium is high, the chloride will be high. And this is also in milli equivalent per liter. The chloride also is an electrolyte, and it helps to regulate the amount of fluid in the body and maintain the acid-base balance. If there's an acid-base imbalance, however, the blood chloride levels can change independently of sodium levels. So just keep that in mind. The next one would be potassium. The normal potassium level, it depends on the lab. It will be 3.5 to 5.5. And this is also in milli equivalent per liter. And as you guys know, potassium is, potassium is really, really, really important. Potassium is mostly found inside the cells. So if the blood potassium level would be low compared to sodium, because sodium is mostly found outside the cells. So if you guys see 3.5 to 5.5, this is a very narrow range of potassium. So less than 3.5, we call it hypokalemia, which is basically low potassium. And more than 3.5, we call, 5.5, we call it hyperkalemia. Yeah, without potassium, our muscles, heart can't really function. You're gonna have arrhythmia if you have either hypokalemic or hyperkalemic. And yeah, this is really important. Sometimes when you guys when we order it in a primary care setting, when we order potassium, and if it's like, for example, 5.6 or 5.7, sometimes majority of the time I will reorder this, because I will reorder the potassium probably in about a week or two, because in the blood in the vial can lyse, and the blood inside the cells contain a lot of potassium. So when it lyses, when the cells lyse, it will secrete all the potassium into the plasma, and you'll end up getting a pseudo hyperkalemia, or a false high potassium level. The main input of potassium in the human body is by just from food. Potato, oranges have a lot of potassium, and potassium is mainly regulated by the kidney. So if somebody has a problem with kidney function, or has acute renal failure, or even chronic renal failure, potassium will be high. The next one will be carbon dioxide, and the value for this one will be 22 to 32 milliequivalent per liter. As you guys know, carbon dioxide is the waste product of respiration in the cells, and it's exhaled through the lungs. Yeah, this test checks the level of carbon dioxide, which mainly is found in the body in the form of bicarbonate. So bicarbonate also is an electrolyte. So this test will tell you the acid-base balance of the body, whether the body is acidotic or alkalotic or basic. At primary care, sometimes we can definitely find patients who have low carbon dioxide or high carbon dioxide, but it's not that important at the primary care. Usually, this one is used mainly in the hospital settings, when the acuity level of patients are more high. The next one would be, this is BUN, or blood urea nitrogen. The level for this one is between, I would say, 6 to 22 milligram per deciliters. BUN, or blood urea nitrogen, it tells you the function of the kidney, and the other one as well is called creatinine. So I'm going to talk about this together. The normal level for this one is between 0.6 or 0.7 to 1.3 milligram per deciliter. Both BUN, or blood urea nitrogen, and creatinine, both will tell you about the kidney function of a patient. So BUN, as you guys know, is a waste product of a protein of a muscle, of a protein metabolism, and also creatinine is a product of a metabolism that happen in the muscles, from creatine to creatinine. And both BUN and creatinine are regulated by the kidney, are cleared by the kidney. So if you see that BUN or creatinine are high, that means most likely the patient has some kind of renal failure. Yeah, the next one will be glucose, which is a sugar. What the lab wants usually is fasting glucose. That's what it tells you here, and it's usually between 65 to 99 milligram per deciliter. In order to check for diabetes, we usually use hemoglobin A1C, but sometimes when you don't have any hemoglobin A1C, this one can tell you a little bit about whether a person has a dysfunction in their sugar metabolism. So The fasting blood sugar level is between 65 to 99. If it's like 110, 120, 130, patients might have some pre-diabetic. The last one that is not in this column are calcium level, or Ca2 plus. Normal level of calcium in the blood is between 8.6 or 8.7 to 10.4 milligram per deciliter. Just want to let you know, this is a total calcium level. As calcium is important in I would say nerve conduction, is important in the muscles. So less than 8.6 is considered hypocalcemia, and more than 10.4 is considered hypercalcemia. I mean, hypercalcemia, I've seen it quite a few times. Calcium is usually regulated by parathyroid hormone and also calcitonin. I'm going to talk more about this in a separate video, but if you guys see somebody with, if it's just a mild hypocalcemia or mild hypercalcemia, not to worry about that, because we can repeat that. And if somebody has hypoalbuminemia or low albumin level, it can also affect the total calcium level. In that case, you want to get a corrected calcium or ionized calcium. So that's it. That's my video on basic metabolic panel. I hope you guys learned something from this, and yeah, I'll see you guys next time.